Virtual reality can make healthcare more pleasant. The proper virtual reality immersive experience will be an golden gift for those who are suffering from the pain.
My name is Jaiyramanan Vijayaalayan, and I'm excited to present my final year project, an innovative approach to a DQN-based personalized pediatric pain management model with tactile feedback in virtual reality exposure therapy. An innovative approach to the pediatric pain management with virtual reality under the guidance and supervision of Professor Prasad Vinvarat. A research in 2022 by D. Silva highlights that in Sri Lanka, over 70% of pediatric patients report a moderate to severe pain during routine medical procedures such as venipuncture, which is also known as blood draws. A research in 2024 highlights that traditional pain management options such as opioids, which is called as painkillers, can be an effective but come with side effects, including sedation, respiratory depression, and potential dependency over prolonged use. Given these drawbacks, there is a critical need for effective non pharmacological alternatives. There have been numerous studies going on the VR's efficacy in reducing pain perception during various medical procedures, including wound care, dental procedure, and physical therapy. The mechanism of the VR therapy is VR works by immersing the patient in engaging virtual environment by diverting their attention from the pain sensation. For example, in the image, a pediatric patient, a pediatric burn patient uses VR to distract during their surgical pains to divert the attention from the pain sensation and activating the sensory pathways that inhibit pain signals. The researcher Hoffman have been done several researches from 2000 to currently 2003. There have been several researches have been done by Hoffman in burn patients, even in spinal injury also. Also, Erin Marchi had gave birth to her second child with the help of VR for easing the pain. The mother said she was so immersed in the VR experience that she couldn't feel the pain much. Okay, so now a question arises. So, what makes a meaningful reduction in pain through VR? As for that, another research answers for that question. As pain threshold is an individual and subjective issue, the VR usage during medical procedures should be personalized for meaningful reduction. The literature review has highlighted the several limitations in the current VR system. The current VR system solely relies on one fits for all approach, and the limited immersion and limited personalization and limited interactivity and limited adaptation according to the pain levels. Many VR solutions offer a preset and experiences that cannot adapt to the dynamic nature of the child's pain experience during the procedure. A static VR environment offer a limited opportunities for interaction, reducing patient engagement and potentially hindering the distraction effort. The limited personalization. Current VR pain management solutions often lack personalization. Experiences are not tailored to the specific needs, preferences, and pain conditions of the individual patients. A 2024 research highlighted. A 2020 research highlighted Relying solely on the visual and auditory stimuli limits the feeling of being in the virtual environments. So, several researchers have been highlight that the limitations currently on the VR system. There is a significant gap in VR pain management studies suggesting future research should focus on improving physical interactivity, personalization, and real time adaptivity are crucial for optimal VR interventions. So, I came to this idea when I was in 2022. The research requirements I identified through initial trials. I did a initial trial in City Central Hospital, which was a small clinical trial which was conducted with a cystoscopy patient. Cystoscopy is like endoscopy. There will be a camera tube will be inserted. That camera tube is inserted through urethra. It's a very painful procedure. The initial trial was conducted on February 22nd, 2023, under the guidance of Dr. Uma Shankar. Under the doctor's supervision, we integrated our VR therapy during the cystoscopy procedure. The patient underwent the snow world therapy.
சுமாராக அது போட்டத்தில் கொஞ்சம் மைண்ட் கொஞ்சம் நார்மல் ஆகிடுச்சு. இருந்தாலும் வருத்தம் விளங்கத்தான் செய்யுது. எனவே ஓகே, அது கொஞ்சம் நாங்கள் முந்தி செஞ்சு பார்த்துட்டு அதனால் அது முந்தி உள்ள பெயிண்ட் எப்படி இப்போ குறவுன்னு சொல்லிடலாம். இருந்தாலும் பெயிண்ட்
இது ஃபியூச்சரில் என்ன மாதிரி வேறு பேஷண்ட்டுக்கு என்ன மாதிரி
உங்களுக்கு இதோட ஹெல்ப்பாக இருக்கும். 100% இல்லை, ஒரு 50% ஒரு ஹெல்ப்பாக இருக்கும்.
இப்போ இதோட நாங்கள் இப்போ கையிலையும் ஒரு ஒரு ஸ்ட்ரெஸ் பால் மாதிரி கொடுக்கலான்னு யோசிச்சிருக்கோம். அதில் அமர்த்தக்குள்ள போட்டில் முன்னுக்கு போகிற மாதிரி.
இப்போ நாங்கள் சும்மா கையை இப்படி ஸ்மூத்தான இப்படியே வச்சுக்கிட்டு தட மாட்டு அப்படி ஒன்றுன்னா நாங்கள்
மற்றபடி உங்களுக்கு இப்போ இதால் உங்களுக்கு ஒரு டிஸ்கம்ஃபர்ட் எதுவும் வந்துச்சா?
இல்லை, அப்படி ஒன்று
இது ஓகேவா?
ஓகே.
இது பாரமாக இருந்து
இல்லை,
கஷ்டமாக இருந்தது?
இல்லை, அப்படி ஒன்று.
The results of the initial trial conducted showed that VR was alone insufficient for the adult patient relief during cystoscopy, with patient reporting high pain scores and suggesting that interaction could enhance the experience. So then I came up with a solution aims and a novel and innovative approach to contribute to the existing gap to address these limitations by developing a personalized interactive system for the pediatric pain management, which uses tactile feedback and DQN model. Tactile feedback for the enhanced interactivity and immersion, and DQN model to adapt the therapy according to the pain levels. The more immersive the VR experience, the more effective it is in reducing pain. Let me explain how the DQN or DeepQN network integrates our virtual reality exposure therapy to provide real-time and personalized pain relief for children. First, the DQN observes the state of the child's using real-time data. So it receives the current heart rate from Apple Watch, the grip force from the sensor-enabled ball, which has force-resistant precision, and the current setting in the VR environment, like which animation or sound is active. The DQN processes this state and selects the best possible action to help the child. For example, if the stress is rising or the pain level is rising, introduce a new visual distraction like a playful animal or a trigger of calming sound. If the child is seems like relaxed, it might do nothing, keeping the scene peaceful. So this decision is made using the DQN's learned policy, which evaluates the long-term benefit of each action based on past session. First, the code manages sessions by continuously monitoring Firebase for session status. When a session starts, it loads the pre-procedure data, which is from the previous session's data, and initializes a deep queue network or DQN agent to learn optimal environment adjustments. Next, the system acquires sensor data in real time, which is from heart rate from the Apple Watch, and the force measurement from stress ball. The stress ball hardware includes a microcontroller ESP32. From the microcontroller, there are two sensors connected, which is inside the ball. The two sensors which is inside the ball are force resistance pressure sensor, which measures the pressure applied to the force. For the haptic feedback, we use a haptic motor. If the force is above 500, the haptic feedback gives a sensation. If the force is above 500. Again, coming to the DQN model, to handle the variability in the force data, which normally ranges from around 100 to 500 units, during normal interactions, we maintain a moving window using double Q, which is called as DQ. This allows us to calculate both sudden spikes and gradual increases that might indicate pain. So, the core logic in the heart rate, which is getting from the current sensor reading, is with the previous values, an update is triggered. If the heart rate changes by at least 5 bpm, or if the force of the from the stress ball data deviates by more than 20% relative to its moving average, or shows a rising trend above this threshold, when a significant change is detected, the system computes a reward. So the reward system, which selects the action which modifies the VR environment from changing the sounds, changing the sound effects, or changing the animation, or changing the VR current environment setup. Finally, the chosen actions are sent to the Firebase to update the environment, and the detailed logs, including the sensor reading, actions, and rewards, are saved. These logs are later used to further train the TQN, creating a continuous reinforcement learning feedback loop. A randomized control was conducted at Royal Hospital LHD to evaluate the deep Q network based adaptive VR therapy system with the tactile feedback under the group B. So the trials were conducted with group A and group B. The group A was the static VR as the traditional VR system used. The group B was the our DQN models VR therapy system. So each group divided into two, as 50. The group, the totally we collected around 50 patients. Each group had 25 patients, and group B has 25 patients. On the 0 to 10 Wong Baker's pain scale. So immediately after the needle procedure, we'll ask the post procedure uh, pain intensity, and also the real time data will be collected from the watch and the ball, also from the states of the VR environment. So there was a striking finding from this research is the number of group B participants with zero pain. 6 children in the DQN group ID 19, 22, 26, 30 and 38 and 50 patient IDs were reported a pain score 0. Even I didn't expect that patient will respond 0 pain. Even I asked around 3-4 times, did you feel at least a single pain from a needle or single pain use while doing this? They said I didn't feel anything. I thought they didn't do any blood draws, they didn't do any injection. And also the clinicians the clinician supported us, saying the procedure is not started yet and they will put the VR. So during that they won't also think that the procedure is going on. So in contrast, none of the children in group A reported zero pain. In the static VR, there was no patient reported. um, the lowest was one patient reported one scale. These zero pain scales highlight how successful the intervention can be in the best scenarios. Examining examining their feedback gives insight into why the system works so well. For example, patient 22 in group B reported zero pain. He stated, I enjoyed the virtual reality therapy because I didn't feel much pain as I was concentrating on the VR game. Additionally remarked, she was a doctor and she was also happy with VR using. She reported that in the last time when she come to the VR therapy, uh, they required around 2 people to handle her because she was screaming to not to get the blood draws, it will pain. So she said she was screaming and it's hard for them to bring for the next time. So this time the parents said it was much easier since she didn't scream and she even enjoyed the process. It's a great relief for us as parents. This feedback underscores the VR game fully immersed the child's and diverting the attention away from the needle to the point of eliminating pain perception. Similarly, the patient 38 showed a complete relief. The researcher observed he was completely concentrating on the scenario, completely immersed in the scene. And her father and his father also was happy with seeing him with no pain. After that, it was clear his focus had shifted entirely off from the medical procedure. So the pain scores were markedly lower in adaptive VR group compared to the group A reported a mean score of around 5.0 on the 0 to 10 pain scale, whereas group B had a mean of 1.8, which is a very low mean score. This 3.2 pain reduction in average is statics. This 3.2 pain reduction is statistically significant. One of the recent fascinated thing in the research was one child around 9-year-old. She was admitted in Royal Hospital. After before discharging, she came to take the blood test. So the blood draw. With the clinical trials, all clinical trials happen during the blood draw, which is called as venipuncture. In that, she was very anxious. In the beginning, she was crying while she was coming into to take the blood test, and her heart rate I saw it's around 135. Very high heart rate. Other patients got around usual heart rate around 80 to 70, within 80 to 90 range. It started with 135 and became one by one the heart rate reduced. Slowly the heart rate got reduced. Around finally it ended up in around 114 heart rate. So there is a significant change I saw in this patient. Too, she said that it reduced her pain while doing this VR, because she was coming very anxious since she was already admitted, and the medical professional said she was there for a long time and admitted, and she was anxious, and she came to the laboratory. So that's why her heart rate might be high. That might be the reason to the heart rate might be high. So they also pretty impressed with that VR device, because in the last video I'll provide their feedback. Those two medical professionals will be giving the feedback on this device.
වෙනදා කියන්නේ බං කියන්නේ ටිකක් කරනවල ළමයින්වත් ඒක අපේ මැනේජර් එක පාසු නැහැ ඒක කියලා. දැන් ආපු ළමයි වුණත් සාමාන්‍යයෙන් ડોක්ටරයක් වැඩි හොඳ පොසිටිව් දුන්නා. දැන් ඒ කියන්නේ සාමාන්‍ය වෙනදා කියන ඇසිරිමානුව ඒ කියන්නේ කලබලකාරී ගතිය අඩු වෙන තිබ්බා. ඒවත් හොඳයි කියන්නේ. සමස්තයක් වශයෙන් බැලුවොත් ඉතින් ඒක ඇත්තටම හොඳ වැඩක්. ඒකේ ප්‍රගතියක් තියෙනවා. ඒකට අවධානයක් දී ළමයින්ට උනත් ඒකට අවධානයක් දී හොස්පිටල් එකේ ගිහලා අමතක වෙනවා. දැන් අපි එක්සැම්පල්ස් එක බලද්දී උනත් අපිට ඒක පැහැදිලිව තේරෙනවා. ළමයි දැන් ගලන්නේ අපිට උනත් ට්‍රාන්ස්ෆරින්ග්ස් දැන් වෙනදාර සාම්පල් කලෙක්ට් කරද්දී සාමාන්‍ය ළමයි අල්ල ගන්නවා. ඒක උනත් නෑ ඒ තරම් ඔක ඔතන කියනවා කියලා